Hello. Hi, Miss Doe. How are you doing this evening?
Fine.
Well, my name is Leah. I'm going to be your nurse today. We are going to be doing an abdominal assessment on you, if you are okay with that. I am going to be explaining things as we go along, and this is basically a demonstration for school. So I will be talking to you as well as talking to the camera. I just want to make sure you are comfortable with that.
That's fine.
All right. So the first thing we're going to have you do is tell me your name and date of birth for verification purposes.
Jane Doe 1101.
Okay. All right, Miss Doe, I'm going to have you lay flat on your back, which is also known as the supine position. During a typical abdominal assessment, I would be revealing the patient's abdomen, but to protect her privacy, I will leave that down, and I will still cover her up though. I will have her abdomen exposed from the xiphoid process to the pubic symphysis to be able to view the abdomen in its entirety. All right. So the first thing I'm going to do is I'm just going to inspect your abdomen. I'm going to look at your skin color, make sure there's no abnormalities with your breathing, make sure everything's symmetrical. I'm going to be looking from your right side as well as your feet to make sure everything's where it needs to be. I'm going to check the location of your umbilicus, which is also your belly button. And then I will do what is called auscultation. And I will listen to your bowel sounds. I will start in your right lower quadrant and work my way around. Make sure they are not hypoactive or hyperactive or absent for that matter. After that, I will do what is called percussion. And I will just be listening to the quality of the sound of your abdomen as I'm going through and percussing. Are you ticklish?
No.
Okay. If the patient were ticklish during percussion, I would have her place her fingers on the abdomen. And then I would place mine there and listen for sound. But Miss Doe is not ticklish, so first I will have you lay your arms down. I would expose the abdomen. I would just observe and inspect from the right side as well as the feet. All right. Miss Doe's abdomen is round. The umbilicus is in the center. Her skin color is even with even hair distribution. Also, the skin's just a little bit lighter than her regular skin, mostly because it's covered. Also, she has a couple visible veins, which is normal, unless the veins were dilated and prominent, which would show signs of liver disease or portal hypertension. Fortunately for Miss Doe, she does not have that. Everything appears to be within normal limits at this time. All right, Miss Doe, now I will be doing the second step, which is auscultation, which is basically just listening to your bowel sounds. I will start in the right lower quadrant where the ileocecal valve is, which is where you hear the most prominent bowel sounds. I will be using the diaphragm of my stethoscope. Miss Doe has active bowel sounds in the right lower quadrant. Now I will work my way to the right upper quadrant. They are also active, and now I'll make my way to the left upper quadrant. And now the left lower. Miss Doe has active bowel sounds in all four quadrants. They are not hypoactive or hyperactive or absent. However, if she would have been a surgical candidate and had just had surgery, absence would be expected. But everything at this point appears to be within normal limits. Now, Miss Doe, we will be percussing your abdomen. You have already told me that you are not ticklish. So what I will be doing is assessing the quality of the sounds on your abdomen to make sure everything's within normal limits. I will take my fingers and gently percuss. A timpani-like sound is considered within normal limits. Alright, and the timpani sound was heard in all four quadrants. Backtrack back to auscultation. I will also use my stethoscope, but this time I will use the bell to assess the sounds of her abdominal aorta. We are looking to hear if Miss Doe has any bruise, which is a turbulent sound in the abdomen, which could indicate an abdominal aortic aneurysm. I will start from the xiphoid process and work my way down past our umbilicus. There are no bruises heard at this time. All right, Miss Doe. Now I will be palpating your abdomen. I will be checking the contour of it to make sure that it is soft and that there are no rigid areas, firmness, tenderness, any masses located. I will also be assessing for hernias, which are most common at the surgical site, umbilicus, and in the groin area. All right, at this time, what I'm going to do is just feel around. The abdomen is round and soft. At this point, I don't feel any hernia areas. In order to make any hernias she may have more prominent, I'm going to have you raise your knees, slightly raise your knees, and then bear down like you would be having a bowel movement. That is also known as the Valsalva maneuver. And also while you're bearing down, lift your head up, and then when I remove my hands, you can relax. All right. So go ahead and lift your head up and bear down. Okay, you can relax for just a second. All right. Lift your head up and bear down. All right. Relax for a second. And lift your head and bear down. Oh, you can relax for me. Currently, I felt no hernias in the area. Everything seems to be very good. There are no rigid spots on her abdomen. However, if there was a rigid area, that would indicate peritoneal irritability or irritation, I should say, and we would have to do another follow-up on that. I also noticed no tenderness or masses in her abdomen area. However, other than her telling me there was a tenderness area, I could have also looked at her face to make sure she wasn't grimacing when I touched any areas. However, had she had a tenderness area, I would have tested for rebound tenderness by pressing on the tenderness area slowly, and as I released, asked the patient if the pain got worse or if it was relieved. However, if it got worse, that means she would have tested positive for rebound tenderness, and we would have had to follow up on that. Rebound tenderness, especially in the right lower quadrant area, is a sign of appendicitis. At this time, I will now have you set up. I'm going to check for kidney pain in the posterior costovertebral angle on her back. I will do this by placing my hand here. Did you have any pain?
No.
All right. It is negative on this side. I will also go to the other side. Any pain there?
No.
All right. So, Miss Doe has tested negative for any kidney pain in that area. So now this concludes the abdominal assessment. I will now thank my patient. Thank you so much for allowing me to do this. Ask her if she has any questions or concerns. I will then go to my computer and document all of my findings so that the doctor can look at that and go from there with that. All right, Miss Doe, thank you so much. I appreciate everything, and I hope you have a good day, okay? The doctor will be in shortly to see you.
Thank you.
All right. And that concludes the abdominal assessment. Thank you so much.